They're clearly taking this very seriously, putting in place lots of measures. You've already heard about the closure of schools, all these efforts really to try and limit the spread. But the focus is on the elderly population. As you mentioned, the death toll now is close to 200. It's 197 to be precise. And the average age, unfortunately, of those who have died is 81. So clearly it's affecting the elderly population. And here in Italy, Italy has one of the world's oldest population. So the authorities have said those over 65 and those who have any kind of respiratory problems really should stay indoors. They've also, as far as the school closures are concerned, they've also called on people to limit their contact and to have enough space between one person and another, particularly in indoor spaces. All this to limit the spread, because the concern, of course, is that we could see an overwhelming situation for the health system in the country. So what the authorities have said they're going to be doing is to call on some 20,000 more additional health service providers. That's doctors, nurses, as well as operators in the health system. They're calling on retired doctors perhaps to come back. The idea is perhaps they're going to convert hotels into hospitals and also to boost the numbers of intensive care units and respirators, all to be sure that the health system can cope with the increasing number of cases, and particularly to help the elderly.